Hi, everyone. Dr. Elizabeth Bonet here. Dr. Liz, welcome to the Hypnotize Me podcast. Before we jump in, please note that the podcast is not mental health treatment, nor should it replace mental health treatment. If you need psychotherapy or hypnotherapy, please seek treatment from a trained professional. I do hypnosis all over the world, so please feel free to contact me through my website, drlizhypnosis.com, DRLIZ hypnosis.com. Hi, everyone. Dr. Liz here. I just want to give you a quick update. I ran the first group online for insomnia this week in the Sleep Better, Feel Better program, and it was a lot of fun. I had a handful of signups. There's about 5-6 people in the group, and I really loved taking the questions and giving the education piece and then doing the hypnosis. So if you're listening to this in the future, just check my website, drlizhypnosis.com, to see if another group is coming up. I wanted to air today's episode because people are struggling with anxiety during the pandemic. Not just people who typically have anxiety, okay, their anxiety has gone up even a little higher, but also people who don't typically have anxiety have been really struggling with it during the pandemic. I went to a webinar with Jonthan Grayson, one of the leading experts in the world on OCD, and it was really good. He talked all about how to treat OCD as well as anxiety because it goes with OCD during the pandemic. So it was really interesting. And then I wanted to give you this discussion with anxiety specialist Elizabeth Cush. She also has a podcast that I listen to, Woman Worriers, and she is excellent. So first, she talks about her own anxiety. Okay, don't get too anxious during that part, all right? Because then we move right into solutions and we give all kinds of different solutions, not just your standard stuff. So I hope you really enjoy it. And if you need help during the pandemic, please feel free to reach out either to a mental health provider around you, or you can reach out to me. I do hypnosis all over the world, so I'm happy to see you, quote unquote, virtually, right? Either through telephone or Zoom. I hope this interview helps you manage your own anxiety and brings you some peace. Hi, Elizabeth. Welcome to the Hypnotize Me podcast.
Oh, thanks so much, Liz, for having me on. I love your podcast and I'm excited to be here.
Yes, wonderful. I like yours too. I said that in the intro to people. We'll just be like fangirls over each other, right?
Exactly.
We have the same first name. It's like, all right. Hopefully
know,
people
right?
won't get too confused. So, today, yes. I really wanted to have you on the podcast because of all the anxiety and stress around the coronavirus. Your podcast focuses on anxiety in women.
Yes.
And you're an anxiety expert in your private practice.
Yeah.
So could you talk to us about some of this and give us some tips to help us out?
I will do my best. And let me just say that I am feeling a lot of anxiety around the virus. And that I think is just to say to everybody, like, that's normal, right? Like we have this, anxiety is a response to a perceived threat. Well, like the threat is real. This is not just, I'm thinking maybe I might get this. It's out there. I mean, and maybe I won't, but it's there. There is a threat and it's dangerous. So it's scary. So it makes sense that we're feeling more anxious at this time than we might when there isn't this direct threat out there.
Yes. Do you think some of it too is because it feels invisible?
Yeah. I think the invisibility of it, the unpredictability, some people get it and have no symptoms. This is what we're learning. Some people get it and get severely ill and some die. So it's invisible and it's so uncontrollable and there's so many unknowns.
Mm-hmm.
And that combination, if you have a little bit of anxiety anyway, or even if you're not an anxious person, those are factors that increase our anxiety. Not being able to control a situation, the unknown, the invisibility of it, that it's like this.
I see it almost like a cloud. Like
Yeah.
when I step out of my house, if I'm
Mhm.
going somewhere, there's articles I've read that are reassuring. Like you can walk down the street alone with your dog, you're probably fine, right?
Right.
Like
Right.
you can walk the
Right.
dog, totally
Yeah.
fine. I'm gonna
Right.
just like descend upon you, But let's say I'm going to the grocery store. It's almost
Yeah.
like, all right, it's this feeling if I could get it from anywhere.
Yes. Yes. And
Yeah.
honestly, the news is not helping with that. I mean, I've seen more videos about how you can catch it and how to prevent it, which makes me insane because I'm like, I'm just going to be wiping down my whole life because it's out there, right?
Hmm.
But two, that it is scary, right? I don't want to get the virus, and I want to be able to prevent, to the best of my ability, to prevent that from happening.
Hmm.
And yet there is this sense that it's just there, like you said, this cloud that is following us around. And it's really hard to relax when we feel like there is a threat that's just out there all the time. Like the world stepping outside my home, even inside my home, potentially might not be safe if I'm not doing my part. So we're constantly in this hyper alert state of trying to keep safe.
Yes. All right. Now that we have the anxiety part described, right? Like,
Yes.
what are some good ways to bring it down, to
Yeah.
manage it? Let's say manage it, because I think to expect it to go away completely is not really reasonable.
Yeah.
Would you agree with that?
Yeah. Managing it in a way that helps you sort of continue to live your life and not feel distress all the time is important,
Hmm.
because otherwise you're not sleeping, you're not eating, or whatever, however you manage your stress. And
Yeah.
it's interesting because everybody does it differently. For me, I'm eating more. I love
I was
food.
going to say, or you're overeating, right? There's some people
Yeah.
who like don't
Yeah.
eat when they get under stress, and there's some people who overeat when they get under stress. Yeah.
Yeah, yeah. So I love food. I'm eating more. My husband has a cocktail after work every day. He's drinking more. Like, so I think all of us are managing that stress differently, but there are ways that we can do it to really help us work on the neurological part, right? So helping our brains feel more calm and
Hmm.
relaxed can really help us. So
I love
I have,
that. I love that frame of it. Like, all right, let's work on the
yeah.
behind the scenes, the neurological. That's how you always see the neurological part, the behind the scenes part. Let's work on that.
Yeah, yeah, because that's what gets overactivated without us doing very much. It just happens, right? And so, what can we do to help ourselves stay more calm? And, you mentioned walking your dog. So, if you have an animal, or if you like to take walks, or if you just want to go in your own backyard and that feels more safe, being outside, being in nature, if you uh, can help naturally calm your nervous system. So, if where you are here in the Northeast, it's just beginning to be springtime, and, taking my shoes off, stepping outside in my backyard, feeling the grass under my feet, taking a deep breath, listening to whatever sounds there are, dogs barking or birds chirping,
Hmm.
particularly sunny days, feeling the sun on your skin, that in and of itself can calm your nervous system. So, doing that a couple times a day, if you can, to
Hmm.
just get outside and take a couple deep breaths.
Yeah. I have a little tiny backyard because I live in a townhouse,
Yeah, yeah.
but I have a little table out there with two chairs. And
Mm,
so I take my coloring book out there at least once a day and just color so that
I
I
love
can,
that.
yeah, so it helps me calm down, and it helps that behind the scenes, and it feels peaceful.
Yeah, yeah. And
Yeah.
that I love that you use it to be artistic and color, and because that too can calm your nervous system. So if you like creative stuff, pen to paper, crayons, drawing, coloring, painting, that too can help you feel very present. Not only, gets you out of your worrying mind, but it also neurologically activates that part of your brain that helps you feel more calm.
Absolutely. Yes. I
Yeah.
have these particular markers that I love how it feels to actually use the markers. Like something about them is just, oh, I
Yeah.
love it. So
Yeah. Yeah. I
it's
was
like, all right.
thinking about like oil pastels too, like that very smooth,
Mm-hmm.
as you color. So yeah, it's feeling the texture of, getting the feeling of what it's like to whatever artwork you're doing. So really involving all of your sensory input,
Yeah.
the sounds, the smells, the touch of something, the feelings, if you're outside with a glass of water or tea or something, tasting what that is,
Yeah.
really
You hit it. I
tuning.
take a cup of tea out there with me.
Yeah, yeah. I can just picture it. I can picture it.
Elizabeth with her cup of tea and her coloring books and
Exactly.
her
Yeah,
markers. And sometimes
exactly.
I play like I'm a fan of Abraham Hicks is like a spiritual person.
Mm-hmm.
So I play some of her videos. So for
Oh,
spiritual support, So
that's
yeah, that's the
awesome.
sound.
Yeah,
Absolutely. Yeah.
yeah. And meditation is amazing. And I know for some people who are anxious, that can be a hard practice to start.
Yes.
But it could be 2 minutes, right? It could be
That's what I
taking,
always say too. I'm like 2 minutes. You can do two,
yes,
can't you?
yes,
Like we
you
can do 2 minutes
can.
right here in session, right?
Right,
Yeah.
right. And
Yeah.
and even that 2 minutes, and you could do 2 minutes 3 times a day or however often you want to do it. But yeah, it can be as short as 2 minutes. The thing about meditation that I love, and besides the fact that it does help me feel more calm and grounded, but it's actually helping your brain find those new neural pathways, that neuroplasticity of our brain. It's giving us a new way to respond to stress, right? So
Hmm.
instead of the go to worry, 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 we can take that moment to say, okay, I can take a deep breath. I can center myself. I can listen to this meditation. And I encourage guided meditation, especially if it's hard for you. Like I have trouble sitting for 2 minutes just by myself without
Hmm.
a guide. So, and there's a lot of very short meditations out there. I know you have
Yeah,
some on
I
Insight
do.
Timer.
You do
I do
too as well?
too,
Yes.
right?
Yeah.
Yep.
Hmm.
And so there are shorter meditations out there that you can access.
I recommend mala beads too.
Oh,
So
I don't know what
these,
they are.
they're like a string of beads.
Okay.
And traditionally it's 108 beads, but it's almost like a rosary. You could think of a
Mm-hmm.
rosary with a string of beads.
Yeah.
And sometimes that gives people who are fidgety something to
Oh,
focus
yeah.
on because you can count the beads or just run the beads through your fingers as you
Mm.
meditate, or you say, okay, I'm just going to run the beads one by one. And when I'm at the end of the string, then I can get up.
Oh, I like that.
Yeah. And there's some really beautiful mala beads if you look on Etsy. Even Amazon has them.
Neat. I'm going to
Yeah.
look for
Mala
those.
is Mala, mala beads.
Cool.
Yeah.
Yeah, I have some polished stones that I
Mm.
think they're like chakra related, like the stones, but I just usually will pick two and just hold them in my hand. I do it as I'm doing therapy sessions online with clients too, just to have this,
Wonderful.
yeah, just to have this tactile, tangible thing in my hand is helpful.
Yeah,
Yeah,
absolutely. Yeah, I
yeah,
could see that. I have crystals in my office. I have some at home
nice.
too, but
Yeah.
the little fountain, the little
Mhm.
beautiful ones that
Yes.
run little water and so there's
Oh.
crystals at the bottom of that. I
Oh,
always like
nice.
them. Yeah. Yeah, it's in my
Yeah.
waiting room. once we can see clients in person again, right? People love my little fountain in my waiting room.
Yeah. Oh, and the
Yeah.
sound of water, right? I mean, to
Hmm.
me, oh, just really soothing and helps you feel more grounded.
We have spending time outside, trying to
Yep.
involve the five senses, some
Yes.
art, if you can do that,
Yep.
meditation, journaling.
And
So,
journaling.
do
Yeah.
you have particular prompts, or could you give someone a prompt that they could journal on?
Yeah. Well, to me, what I've been journaling on, because
Hmm.
this is a stressful time, is just acknowledging the stress. Like, what was today like? I have been trying to journal at the end of every day during this
Mm.
period of time. And
Hmm.
while we're at, here, we have to stay at home and just acknowledging, how do I feel right now at the end of the day? Because me personally, especially because I'm an anxious person, I tend to just push it away. Like, I'm good, I feel fine. But to sit with it and say, okay, I feel this tension in my chest. So really going into my body, like, where am I noticing it? What is it feeling like? So I'm not trying to figure it out. It just is saying, this is here. And
Hmm.
can I just be with that? So I think for each person, journaling is a very individual experience, but acknowledging feelings, allowing yourself to get curious about how you're experiencing the stress physically
Hmm.
in a journal can be helpful, because as we tune in and get curious, we find there's less judgment. It's just, this is where it is. So,
Yes.
yeah.
Yeah, I find that too. I'm a journaler myself.
Yeah.
And I tell people, like, Dora, you can journal on paper. A journal could be an email to
Yes.
yourself.
Yeah.
I
Yeah.
did it a whole year or two that way one time, where the
Yeah.
emails went into a special folder.
That's
You
cool.
know? Yeah.
Yeah.
You can do it all kinds of ways. You can do it
Yeah.
on your phone if you want.
I was going to say, I think there are
Yeah.
apps now for journaling on your
There
phone.
are, yes.
Yeah.
Or you could video journal if you wanted to do that.
Yeah. I
Yeah.
just ordered a really beautiful one from Barnes and Noble. Amazon, like, all the ones were like terrible. And I'm like, ugh, but I like
Yeah.
it to be pretty. I want
I
it to
do
be.
too. Yeah. I get a Barnes and Noble too, actually, for my journals. Yeah.
Yeah. Yeah. So I just got a new one delivered because I'm about to run out of space. But I also have journals for different things.
Oh, you
So,
do? For what kind of things then?
I have a writing consultation group that I do. So I have a journal for that. So if we have writing prompts, they all go into that journal. I have a group of women that I work with that through movement, and we are now not sadly meeting face to face, but there's always a journaling component to that, what your experience is like as you move together. And so I have a
Cool.
journal for that. And then my personal journal that I write in at night at the end of the day. So, yeah, I don't know why it
Wonderful.
helps it feels nice to have these little different compartments.
Yes. And I know people have gratitude journals
Yes,
too,
yes.
that they just
Hmm.
do gratitude in those.
Hmm. Yeah,
Hmm.
yeah. Yes.
Wonderful. I was going to say I use my dream book planner. It has a gratitude component to it.
Oh,
Yeah. And so that's where I do my daily gratitudes. It asks for five, and I
that's
can usually
nice.
come up with five pretty easily.
To me, um, gratitude can just be something so simple, like a hot cup of coffee or tea or
Yes.
sunshine or whatever.
Yes, absolutely. So you were going to say another one?
I was going to say, lastly, we're feeling a lot. We're holding a whole lot right now. And that whatever you're feeling is okay. Like, reminding yourself that it's okay if you're having a bad day, or it's okay if, like, today is a good day and you enjoyed the fact that you didn't have to see anybody. Like, it's all okay. Our feelings are just that. They're feelings. They don't mean anything about us. It's not something we need to judge ourselves around. There are
Hmm.
feelings, and we're going to have them whether we want to have them or not, right?
True. Yes.
They're going to show up. And if we can acknowledge them and be with them and be okay with that, I think that helps with anxiety as well.
Absolutely. Just accepting your feelings that they come and they go.
Yep.
They do change,
Yeah.
that they're
Yeah.
okay. It's okay to feel whatever you're feeling now.
Yeah. Yeah. Because a lot of us are feeling a lot of things.
Yes. In DBT, dialectical behavior therapy, there's a worksheets around changing a feeling you don't want to have. But the first step is really acknowledging what the feeling is.
Yeah.
Like,
Yeah.
what is it you're feeling?
Right. Right.
And
And
then,
sometimes naming it is enough to help it feel less terrible.
absolutely, yes, like let's name it.
Mm-hmm.
And now, are you getting stuck in it? Like, if you're getting stuck of
Right.
it in it, and you
Yeah.
really don't want to be stuck in it, all right, let's look at ways you can change it. And I
Yeah.
think all of the things we've talked about are actually ways to
Mm-hmm.
help yourself feel better, to help
Yes.
yourself change it if you want to change it. Sometimes what we call a state change is enough. So a state change is, all right, let me move from where I
Yes.
am to another room.
Yes.
Let me see if I can take a walk outside, depending on where you are in the world.
Mm.
Let me see if I can go take a bath or a shower. Or let me just get a glass
Yes.
of water. That's a state change,
Yes.
and that can help.
I think particularly if you've had trauma and when you're in a very fearful, anxious place, you feel stuck, like you said, very stuck in whatever it
Mhm.
is. Movement can be the last thing you want to do, but it's the best thing that you can do. As you said, just to get up
Yeah.
and get a glass of water or move from one room to the next,
Yes.
it can shift things.
Yes. Absolutely. I think that's an important one for anxious people as well,
Yes.
because sometimes the suggestion to sit, which is really good for you too, like sit and meditate even for a couple minutes,
Yeah.
just feels intolerable to them. They're like,
Mm-hmm.
no, I have to move. So move if you need to move, right?
Yeah.
Do a little
Yeah.
mini workout or some push ups, even, or
Yeah. Turn on some music and dance.
absolutely just move. Yeah.
Yeah. Yeah.
So thank you so much for being on the podcast. Please tell
Oh,
people how to find you and how to find your podcast.
all right. So you can find me professionally at progressioncounseling.com. I am in Annapolis, Maryland. My podcast is Woman Worriers. So not warrior. It's a play on the warrior persona. So so womanworriers.com. Both are housed under progressioncounseling.com. So you can find them both there.
Wonderful. And I'm going to wrap up with a quote by Thich Nhat Hanh.
Ah, awesome.
Yeah, it's on my calendar here, sitting right beside me. So I glanced up and I was like, wow, that's exactly what we're talking about.
Nice.
So it says, every time you breathe in and know you are breathing in, every time you breathe out and smile to your out breath, you are yourself. You are your own master. So I'm going to read that again so people don't have to rewind. Okay.
Yeah.
Every time you breathe in and know you are breathing in, every time you breathe out and smile to your out breath, you are yourself. You are your own master.
Mm.
Yeah. So thanks again for being on.
Oh, thank you so much for having me. I really enjoyed the conversation.
I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis, So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace.